educate the staff on the importance of oral care. And I think that's a really big asset, especially because a lot of long-term care facilities have Alzheimer's patients, dementia patients, and even if they don't have that disease, they still have issues with memory. So by focusing it more on the staff, we were able to make a bigger impact for the health and the well-being of the residents there. So in 2016, January 2016, we traveled to Gorham House Nursing Home. It's in Gorham, Maine, and there we had 2 days, 3 sessions each for 1 hour, so a total of 6 sessions, where we educated the staff on the importance of oral care, what to look out for, what medications to look out for, how systemic conditions can manifest themselves intraorally and extraorally. And then we also focused in a lot, or Kelly Doliak, our OT member, focused in a lot on how to adapt a toothbrush to better help the people or the residents with arthritis. So she really focused in on gripping certain things and adapting toothbrushes, toothpaste, sinks, things like that. So she was a really big part of our team, and she wanted me to make sure that she got a part in this because she couldn't be here because of rotations, but she was a big part. So after that, we had a really great response from the Gorham House, and so we are reapplying for our mini grant for this coming January of 2017. We're also going through the IRB and hoping that we'll get approved in order to collect data so that we can have concrete evidence showing what our interprofessional team was able to achieve by educating staff at the Gorham House, and hopefully reach out to other nursing homes, the knowledge that they're able to have in order for them to better the lives of their residents. So I'm going to hand it over to Cassidy. She's going to talk a little bit about how the team helped us, was beneficial to the students, not only the staff.
Alrighty, hi everyone. I really think it's really important to be a part of an IPEC event, and I would definitely encourage it for those who are thinking about it. It was really fun working with different health professions and getting to connect what they know and what they learn to what we know and what we learn in our profession. So kind of like what Regina said, learning about with the arthritis patients how to better adapt the toothbrush from an OT major was awesome. And then with the pharmacy, getting to know all the different side effects that medications can give for the elderly patients, that's really nice to know. And it's things like that that you don't really think of until you're one-on-one with other different health professions.
Yep, so that's our brief overview. I do have at the end of the slide just a contact information. I'll be graduating in May, so if anybody's interested in maybe continuing this, please contact me. A text message fine too, but email's probably better. So thank you.
Thanks a lot. So the other topic area that we're covering today, very comprehensively, is the Interprofessional Team Immersion program. So the Team Immersion, we invite 6 to 12 students from each of the health professions here at UNE to participate in a longitudinal experience where they form a team, work together on a case, and then meet a standardized patient and have the chance to do a physical exam and client meeting with a standardized patient. That happens over the course of 3 meetings. We had 6 teams, and we have 6 teams presented here in one way or another today, and they're completing posters or presentations to complete their requirements for the honors distinction. The Synergistic Compassionate Collaborators have a poster. Group number 4 has a poster. The group Pledge has a poster, and we have 3 presentations. We're going to start with Collaboration Nation. Where are you, Collaboration Nation? And one of these is yours, should be. you go, 5 minutes.
Okay, so we are Collaboration Nation. I am Kira. I am a first-year OT student.
And I'm Jess. I'm a third-year PT student.
Unfortunately, our other group members were not able to make it today just because of the whole last-minute finals thing, but here we are. So we just kind of did a something about fall prevention for older adults and the older population, and it is a huge problem that is interdisciplinary in itself. So when we were working with our client, the biggest problem that he identified was his falls. So these are just some brief statistics on falls, some of the causes that can perpetuate a fall, and kind of the outline of how treatment usually works. So our osteopathic medicine students, they focus most of their intervention based on care coordination, just working with the patient, getting an idea of their medical history and that kind of thing, their medical management. So what kind of prescriptions are they taking? How are they affecting the body? Are they causing the falls? Do we need to up them to help reduce falls? And then they also focused on the chronic disease management. So our client did have diabetes, so that was something that they were very focused on, and managing that medication and making sure that he was monitoring his diabetes as well.
And then so the nursing student that was with us kind of took the role of the dietary aspect because he was having some tooth pain while he was eating. She also said that just for her profession, they look to educate the staff members at the hospital on fall prevention. They talk to the family members about how to keep their loved ones safe. Some other ways they do educate about fall prevention in the hospital is having the patient wear yellow socks, or they hang a fall leaf on the door just to make it aware that this person is a fall risk. And then just doing hourly checks and having them wear non-slip socks. So the physical therapy approach is taking a review of the intrinsic and extrinsic factors. And then some of the key questions we want to ask is, have you had 2 or more falls in the past year? Have you had a recent fall? Or do you have difficulty walking or with your balance? From there, we kind of do a review of systems to determine if there's any impairments in the neurosystem, the cardiovascular system, or in their musculoskeletal system, so if they have any deficits in their strength or range of motion. The physical exam, we would do a foot inspection to see if they have protective sensation, if their gait is impaired, and some quick balance tests that we like to perform is the 4-stage balance test, the modified CT-SIB, and the timed up and go. And each of those tests have cut-off points to if they score above or below it, we can kind of see if they are a fall risk. And then we'll do a home evaluation and recommend them for wellness groups, like the Matter of Balance. It targets the person's fear of falling and increases their overall activity in the older adult population.
So kind of going off what Jess said, as OT, we work very closely with the PTs, especially in fall prevention. We kind of take into account the whole client and see where their fears are, where they may need a little bit of assistance. So I kind of just focus mostly on the home safety and modification. We start by creating an occupational profile, which is basically just an introduction to the person, who they are, what they care about, what they like to do, what's meaningful to them. And then we kind of go to a home safety assessment where we actually go into the home and we assess all the different factors of their environment, what things are safe, what things are unsafe, how can we help them navigate through their home safely, what things can they improve on, different strategies for navigating around their house safely. And then we kind of just modify and educate. A lot of it is collaborating with the client and having them kind of guide you through the treatment plan. So we really focus on getting at what is most important and valuable to the client, and then we kind of just give them the little step that they need to help get to where they want to be. So our approach to this, we just kind of took a step back and just kind of identified each other's roles and responsibilities in terms of fall prevention, and that was just our first step, so that we had a good knowledge base of each profession. And then each of us kind of did our own little evaluation and assessment, and then we kind of used those findings to come up with a plan of care and see what we needed to do for our client. We had goals that we made for him and that he collaborated on us with, and then we wanted to implement that plan to help our patient achieve those goals.
So this is just an example of the case that we had. His name was Michael. We determined that his risk of falls was because of his impaired balance. He had complications relative to his diabetes, and he was on a lot of medications. So the DOs tried to talk to him and make recommendations about what medications he can stop taking and how they could kind of decrease the interactions he was having. Another recommendation we did was the home safety assessment, and we just gave him like a pamphlet that he can take home and check off with his niece about different things that he can do in the home. And then we recommended a wellness journal because he wanted to, the motivation was there, but he just had a hard time keeping track of everything. So we suggested that if he wrote a lot of it down, he can kind of keep track of it that way.
And we're done. Thank you.
So Collaboration Nation, next we'll have a presentation from One Health. And is your... Is one of those yours? Yeah, there you are.
Are you going to start it? My things at the end. Okay, then I'll start it. I don't know. I can do either. I'll just click through and talk, and yeah, we got this. Plenty of space. Yeah, we'll make do. All right, as we get situated up here, my name is Sydney. I am an occupational therapy student. Our team is Team One Health. So today what we really wanted to do is kind of talk through our experience as working interprofessionally. For a lot of us, this is a new step through the process of our career. So instead of going through, because a lot of us had very similar experiences with Michael, we kind of want to just talk through what we interpreted the experience to be like through each one of our programs, and then we'll talk a little bit about what our role was. So, if I can figure this out. All right, so as you all know, Michael Smith was our case. I believe we did make up that last name. He was 71 years old, and that's a list of his chief complaints and his health history. Which one of you guys are talking? Oh, there we go.
Hi, I'm Krishna. I'm a third-year dental student, and so obviously my role in this project was to address his dental pain and disease. What I took away from this project, however, is really that that teamwork, collaboration with my peers, and knowing that we all have a science background. We all could recognize some similar things, but all of us have our specialties, and I was able to, when we split up into groups to talk to our patient, we recognized who was important to speak to the patient, and that we can rely on our peers to communicate important information. So, for example, I know that I relayed information to the nursing student about, talking to the patient about making sure that they come visit the dentist to get more comprehensive dental care, just because, you want to make your time with the patient efficient and make the appropriate referrals.
Hi there, I'm Devin Hardigan. I'm a first-year PA student, and Tiago and Helen and I all work together collaboratively to talk about our medical diagnosis and how we wanted to work with Michael. I personally found myself stepping back from our conversation as a group because we had so many voices going on, and we kind of just needed somebody to help coordinate our overall goals and thoughts as a group. So I just tried to listen a lot to our essentially round table meeting, and what everybody was bringing to the table, and then tried to help guide our diagnosis and essentially our care from that point. Not necessarily trying to intervene because everybody has more expertise in their own specific area, but just trying to coordinate so we could figure out where we wanted to go from there.
Hi, I'm Susan. I'm a third year in the pharmacy school. Sorry about this. I can't talk. I'm recovering from a cold, so sorry about that. So basically what I did, I assessed the medication list that Michael had, and I determined where the fall risk was coming from, which one was the huge risk factors for it, and tried to come up with the plan that will improve his quality of life, and so he wouldn't fall anymore.
Hi, I'm Courtney. I'm in the Accelerated Nursing Program. My role for Michael's case was a lot of patient-centered care and establishing trust with the patient, because we spend a lot of time actually in the room with the patient and relaying messages from other practitioners. So another one of my roles was to be a liaison between all the practitioners and the patient. It's just unrealistic to be able to have all the practitioners in the room at one time. So as Krishna said, she, as a dentist, she wasn't able to come into the room, and I made sure to relay information to the patient about going to the dental visits. And yeah, it was also really nice to be able to work with everyone and learn everyone's specific roles, so that I know when I go out and practice who I can refer to for everything.
All right, well, this is my thought process in meme form. So starting out, I have Dwight up there. So my role, one of my big roles was going in and conducting an interview with Michael to see what his goals were. And then kind of telling the group that and making sure that we were on the same page to make sure that it was client-centered, and that we weren't working on if he didn't care if he had microwavable food or not, and he wanted to work on walking. That was my goal, to make sure that his voice was heard and that we all heard it. So going into the interview, the nerves were going, and because we had a real patient kind of thing. And then, no, is this interview ready for me? So then our next one, we had to bring all of our thoughts together and make sure we only had one more session with him and his niece. So having that one session to bring all of our thoughts and all of our needs for Michael and Michael's needs all together, and it's complete chaos, and we're trying to text back and forth and figure out times everyone can meet. So working interprofessionally, that's a huge thing, is making sure you have time with your team. And we all are in school, we all have outside jobs, family concerns, student concerns, everything like that. Ow. So it's chaos, it's crazy. So that's something that we all had to consider. And then the little cat up there, it's such a great experience that we all got to have. So taking away from this into our practice and taking what we learned as working interprofessionally and listening to what everyone says, but then also listening to what our client says, is a huge thing that I took from this, and making sure that we know what's going on.
So we are actually out of time, so I'm going to quickly go through this slide. Thankfully, Jessica Ainsley did a very good job on the last presentation of describing exactly what we do as a physical therapist, so thank you very much for that. Really, those bulletin points up there are kind of like what I took away from this, and a big one was to be able to take a step back and understand that other professions can be good advocates for my profession, and that's really important because, as stated, it's not realistic to have everybody in there. So, in conclusion, we feel like we did a really good job. Jim Cavanaugh, he was our faculty mentor, and he did a really good job of making sure we stayed on track and really did that during our group meetings and that our timing was correct. But also, I think one of the biggest things that we did was understood that, especially with Michael, he got very overwhelmed. And so having only one person in the room and having them be the ones to talk to the patient and then recommending the certain services we suggest was the most important thing for him, and we were able to do that successfully.
And last but not least, for interprofessional team immersion, we're going to hear from the symbiotic spoons.
I'm not sure who's first. If you want, I can click through it. Well, it's doing the intro. Don't forget to introduce yourselves and everything.
It's totally up to you. I look good here. I got this. Are we good to go? Okay. Hello, everybody. My name is Rachel Draper. I'm from the College of Osteopathic Medicine, and everyone else is going to say their names as we go down the line going through our PowerPoint. But we are the symbiotic spoons. We came up with the name because we used the letters that started with our profession. So we had S for social work, P for PA and PT, O for OT, osteopathic medicine, P for pharmacy as well. I knew I was going to forget pharmacy. I just looked over that. And N for nursing. Just to give people a little bit of perspective on what we did, just in case you weren't part of the interprofessional program, we had a standardized patient, people have gone over this, his name Michael. We went through him having a lot of comorbid issues that we needed to deal with, and we basically came together as an interprofessional team to figure out what we would do all together to make his healthcare better. And everyone else is going to go through and explain what their reflections were, kind of our before and after thoughts on what we did during the experience.
So my name is Marina. I'm a third-year pharmacy student, and my pre-concerns, I guess, are almost kind of shown now. Pharmacy is traditionally forgotten as the profession to consult, which is pretty ironic. But you know, I surprisingly walked away with being really welcomed in the group, and my ideas were really valued. So I was really happy about that. And yeah.
I'm Amy. I'm a third-year PT student. Our initial thoughts were we were wondering if there was one right answer before starting this project, and then afterwards I kind of came to the conclusion I was more aware of how professions think alike about the same problem, and we all maintained the same common goal and outcome.
Hi, I'm Sarah Chatham. I'm a first-year physician assistant student, and I was initially questioning my role as a PA student, having two DO students in the same group, and what I could add. But after going through the whole process, we all shared the responsibilities equally and all valued each other's opinions.
That's me. I'm Ginsberg. I'm a first-year OT student. Initially, I thought that OT was going to be misunderstood by the other professions, so sort of getting my role across as, you know, I'm not just here to help our patient find a job. I'm here to help him find out what's meaningful to him so that we could guide the best intervention. So after the IPTI experience, I realized that, you know, the emphasis on collaborating and communication is really important when working with a client and for a client to improve their quality of life.
Hi, I'm Sarah. I'm a second-year osteopathic medical student. Rachel and I were the two DOs students in the group. So before this experience, we were really curious how our osteopathic mindset would really blend in with the rest of our colleagues. And after meeting Michael and doing our treatments and diagnoses and everything, we really found out how similar we all had that mind, body, spirit, really whole person approach. So looking back on it, we kind of can look at it like a Venn diagram. So right now we're all kind of in the middle as we're learning how to be healthcare professionals and dealing with different patients and problems. And as we progress, we'll really be able to see that Venn diagram move out of the middle. And this experience was really great because it really highlighted how we're all growing and learning, and it really brought it all together for us. So it's great.
I'm Hannah, and I'm in the accelerated nursing program. And I think we were all a little apprehensive going into it about how we would work together and what the group dynamic would be, but ended up being great. We worked really well together and really enjoyed ourselves throughout the process.
So just a couple concluding thoughts, kind of just reiterating what Hannah just said really quickly, is that we all came in kind of apprehensive. We really worked really well together as a team, and what we really discovered was that we were able to give great comprehensive healthcare to this person by we're all working together and having our different mindsets from different professions. Thanks. There we go. Thank you.
Thank you, teams. And if you're interested in being on the Interprofessional Team Immersion, talk to your faculty about it. We are recruiting for spring, and we have slots for 6 from each program for that. The other topic area that we're covering today is the interprofessional experience in Ghana. We have 2 posters about the experience in Ghana, and that's such an interesting program. And you'll know the Ghana presenters by their pants, because they're all, or shirts. They're wearing Ghanaian fabrics in their outfits today, which is great. So we'll have a chance to check into those as soon as we complete the presentations. The other topic area is an interprofessional clinical type experience, and it happens at a pain clinic in Mercy. So there are 3 posters about the pain clinic at Mercy, and I would encourage you to check those out. And we do have one presentation from none other than Ian Imbert from the Center for Health Innovation. And the Center for Health Innovation works on the clinical placement end of your IPE experience. So here we try to expose you to the competencies and the many different ways that you can work together. And he's working on providing opportunities for you to continue that work in the clinic with consciously interprofessional opportunities that follow on from what has happened here. So Ian's going to talk a little bit about that. Thank you, sir.
Well, it's great to see such a large turnout today. So many interprofessional projects going on throughout the semester, and surely so many of you going for the IP Honors Distinction. I received my honors distinction in 2015, and when I think back to my academic tenure, I can honestly say that the learning activities I participated in with IPEC were some of the most memorable experiences I had during my academic tenure. So thank you, IPEC and Shelley and Chris, for continuing these opportunities. So again, I'm Ian Imbert. I'm the project coordinator for clinical and professional education in UNE's Center for Excellence in Health Innovation. The Center for Health Innovation is in the little-known Linnell Hall. It's over by Alexander Hall and the Wing Lounge. The Center for Health Innovation provides learning activities that can also qualify for your IP Honors Distinction. We have a variety of different learning activities that students can participate in, both in their didactic and in their clinical years. A couple of examples of some of the learning activities we offer are things like participating with Maine SNAP Ed, which provides nutrition education for low-income families. Those opportunities exist throughout the state of Maine, and so whether you're doing clinical rotation or you're here on the Portland or Biddeford campus, there's opportunities to get involved every single day. So if you're interested, feel free to reach out to me. Another opportunity we offer, our clinical educator of IPE helped coordinate about a dozen flu vaccine clinics this fall, where students got to work interprofessionally to provide flu vaccines to homeless, recent immigrant, and other vulnerable populations in the greater Portland area, as well as Augusta and Saco at the VAs. Another opportunity we have is the Rural Health Immersion. We're offering our next Rural Health Immersion over spring break, where we'll take 15 students from 5 from each of 3 different programs and immerse them into the healthcare and culture of a rural area. For the March experience, we'll be going to Western Maine, and we'll be taking 5 medical, physician assistant, and social work students to the Western Maine area. So if you're interested, talk to your program directors or reach out to me. We'll have another rural health immersion coming up the end of May. It'll be another week-long rural health immersion somewhere in the eastern part of Maine, probably mid-coast. All of these learning activities you can find on our posters. I know it's probably really hard to see, but these are posted up around campus. So we'll have a new series of posters coming up in the spring with the learning activities that'll be offered in the spring. Our culminating sort of clinical IPE opportunity for students are clinical interprofessional clerkships. So during your clerkships, when you go out to your clinical sites, we have some clinical affiliates who offer some kind of IPE model. It looks different depending on where you are. To give you a couple examples, it might be a medical and pharmacy student doing shared patient visits in Augusta. It might be a medical, pharmacy, and social work student in Bangor doing home visits with a community care team. It might be medical, physician assistant, dental, pharmacy, and we have in the pipeline PT and social work students doing IPE learning activities at Maine's largest federally qualified health center in Bangor. Or it might be doing patient cases and working on oral health for primary care with medical and dental students in Rumford is another site we have in the pipeline. So a lot of different opportunities to extend your IPE learning experiences into your clinical clerkships. And so if you're interested, please reach out to me, reach out to your program directors about which sites might offer these IPE opportunities. And so as you're all thinking about choosing your clinical site placements for the 2017-2018 academic year, please keep these clinical IPE clerkships in mind and feel free to reach out for me for any more information. Any questions? Thank you.
Thank you all from IPEC. Thank you for being great team members and collaborators and leaders and followers. We have 45 minutes now to walk around and look at each other's posters and talk to each other about your projects and your ideas. And we will have a roving reporter going around interviewing people about their posters. So be ready for that. Enjoy. Have a great day. We'll see most of you, hopefully, on Friday when Eric Harum talks to us about expert training from 1 to 4:30. Thanks.
Hi, everyone. Welcome to the Interprofessional Education Collaborative poster session and presentation. My name is Sarah Porter, and I work in the IPEC office along with Chris Hall and two of our graduate student work study students, Julia and Nora. So this is our IPEC poster presentation. It should be very exciting, but we're going to be, I'm going to be going around and talking to various student groups. Some of the posters range from the Interprofessional Team Immersion to the mini grants to student volunteer activities and whatnot. It's just being out in the community doing interprofessional work. So we're going to get started on the interviews in a minute, but it should be great. So thank you for watching, and let's get it started. Hi guys. So do you mind talking to me a little bit about your project? If you don't mind, first I'm just going to quickly scan the poster. It looks great. You guys did a fantastic job.
Thank you very much.
I think maybe because we put, And, alright, so just a second. I would like you all to introduce yourself and say what program you're a part of. So I'll go around.
Alex Carlson, I'm a member of the College of Osteopathic Medicine, class of 2020.
Great, thanks.
John Reeder, College of Osteopathic Medicine, College of 21.
Wonderful, nice to meet you. Someone's going to get dizzy on this.
I'm Charlotte Barker. I'm also from the College of Osteopathic Medicine in the first year.
Excellent, thank you.
I'm Katie Finch, and I'm a social work student.
Wonderful.
Caleb Demers, social work student.
Great. Well, we love this interprofessional collaboration. So I just wanted to ask, if I know it's loud in here, I apologize, but tell me a little bit about your project and what you did, just kind of some of the highlights.
Yep, certainly. So we were a part of the Mercy Pain Clinic. And we met as a group, and we were presented with a case. It was a real case, a real client, and we first learned about that client, and then had an initial meeting where we had an initial physical examination, and then met again, came up with a treatment plan, and then throughout the course of our semester, implemented that treatment plan, adjusted when we met with our patient. And so that was kind of the initial structure.
Yeah.
And we learned all sorts of things. I mean, I think for me personally, it was definitely really important to learn about the different roles that everyone plays. I really didn't know a lot about what pharmacy students could provide. I wasn't really, wasn't sure what all the different professions could provide in this situation. But because of this particular client, I really felt like there was multiple disciplines needed to give her the best treatment. So that was definitely something I learned.
Great.
Yeah.
Does anyone else want to share thoughts and?
Yeah, he's our spokesperson.
What about it, kind of surprised you the most about this project?
That's a great question. I think I was thinking about this a couple days ago, how I felt very surprised about. At first, it felt like we were all kind of advocating for different avenues to go down with our treatment, and so maybe for the social work students, we were really trying to work on building trust and working on her anxiety. But then for some other students, it was something different. But as we kind of gained a relationship with each other and really kind of understood where we were all coming from, we realized we were mostly advocating for the same thing, which was just the best treatment for that client.
That is great. Would you do it again?
Would I do this program again?
Yeah.
Certainly.
Oh, great. That's excellent. Does anyone want to add anything? Well, you guys, again, you did an excellent job. Just getting the whole screen in here. Great. Well, thank you very much for taking the time to explain your project to me.
Yeah,
Sounds fascinating. This is the lovely Chris Hall, the brains behind IPEC. Now, do you mind if I interview your team? So first I'm going to get kind of a good look at your poster. This looks great, guys.
Thank you.
What a lovely team you have. So if you wouldn't mind introducing yourselves and saying what program you're a part of.
Hi, I'm Jenny Chang. I'm a second year student at the vet school.
Great, thank you.
I'm Ethan Duane, also a second year student at the Osteopathic Medical School.
Wonderful, thank you. So tell me a little bit about your project and who helped you work on it. Who was part of the team?
Dr. Tell, she's the head coordinator, the PI of this project, and we work with Dr. Stephen Hall, pain specialist at Mercy Hospital. And part of the team, as you can see here, we have a pharmacy student and OT student, and then she's a nurse. And the people who work in this picture are the social worker and anything else. I think that's it. We're missing a PT student that we didn't have on our team.
Oh.
Yeah, so it was very great because we got to follow the patient through all her clinical visits and even at her Omen visit. And at her Omen visit, the doctors pointed out that her chronic pain is most likely due to her childhood PTSD. And it's just a lot of the stuff that we learned as we already kind of knew, but really reinforced the values of like an interprofessional healthcare team treating a patient and just being part of it in it, like really seeing the values of that.
Oh, that is wonderful. Great job. Now, what do you think made you successful in this experience? Like made your group successful in, working patient care with the model and whatnot? What do you think helped your group be successful?
Like, one of the things that made it successful was the fact that we were all there, like, for the interprofessional experience in part. So, like, we were all willing to listen to each other's opinions, and we wanted to learn from each other, and we also wanted to tell others about what our profession could contribute.
Yeah.
And so our case was a really good model for that, specifically because our patient had a case of chronic pain that likely wasn't going to be relieved. So a lot of our discussion turned into, we're not going to relieve this patient's pain. What can we do to improve her quality of life overall? So as in medical school, that's not something that I've learned about as much. I know how to diagnose and treat some things, but the OTs and the PTs were really able to help with like, oh, maybe we can look at her counter heights or adjust her toothbrush, just like little basic things that would help her life improve. And then we got input from pharmacy to try to help reduce side effects of her meds, and we were able to really collaborate on how to improve her overall quality of life.
Oh, that's great. So basically you're saying that it wouldn't have been as effective and successful if it wouldn't have been an interprofessional approach.
Absolutely.
Yes, because each profession had like stuff that they know about and very like specific things, and so we would catch each other like stuff that we wouldn't see. Like we were each other's safety net, I would say that.
Yeah, that is excellent. Well, again, you guys did a great job. I'll take one more image of your poster. And I know it's loud, so thank you for bearing with the distractions. But great job. Thank you. There's Julia. Say hi, Julia. Chris and Dave. As we're wandering over. Hello.
Hi there.
So I'm just, if you don't mind, I'm going to ask just a couple questions about your team immersion project. See, there's the lovely team members. I'm just going to get some images of your poster. So as similar to some of the presentations we heard, this poster worked with Michael, the patient, or this group worked with Michael. So tell me a little bit, well first can I go around and say your name and what program you're part of? So who wants to start?
Okay. My name's Tara and I'm from nursing.
Great, thanks.
I'm Sandy, I'm from occupational therapy.
Wonderful.
And I'm Courtney, I'm from physical therapy.
Great. Well, it's nice to meet you all. And so let's talk about, so you met Michael, the patient. What were some of your initial thoughts about going into the experience and kind of knowing that you were going to interact with a real patient and whatnot?
I think initially we had many thoughts kind of floating through the air. Each one of us, our thought process a little different. We were concerned we had a lot of medical complications, a lot of comorbidities, a lot of things going on. So our main concern was how do we as a team, in such a short period of time, we had 2 12-minute sessions to kind of complete our evaluations thoroughly. How do we as a team kind of pull together and we are dealing with a real person here, so how do we provide high quality professional care in that amount of time? Was our big concern, I would say.
Yeah, no, that's great. Anyone want to add? Hi, Tenny. Want to introduce yourself to?
Hi, I'm Tenny Shardlaw. I'm a second-year PA student, and I serve both as a team member and as a student facilitator for a team pledge.
Oh,
and
great.
It was a privilege and an opportunity to work with this amazing group of professionals. I feel very confident as an older person that my health care will be well taken care of as I age, based on what I learned from these individuals.
You're not old.
Oh, yeah, I'm in my 5th decade, so I'm a little bit older than the typical student. So.
Well, you look great.
Thanks.
Is this a member of your team
Yes,
also?
this is Evan. He's
Hi,
also a PA
Evan.
student.
So
my name's Evan Xanthos. I'm a first-year physician assistant student.
it is wonderful to meet you, Evan. So your group was just telling me about, now talk about, what was something that, if you could go back and do it again, do you think you missed anything? Do you think you got exactly what you wanted out of the experience? Do you have any suggestions? More time?
It just seemed like there was a lot to do in a very short amount of time. I mean, we got it done, but I would have liked a little bit more time.
Now, are you talking time with the patient, time as a team? Okay.
Time with the patient.
Yeah.
I think we did a really great job of meeting beforehand and coming up with a plan.
Oh,
we
that's
did a lot of work beforehand.
Great.
I do think, though, looking back on it, it'd be great, like, our second interaction with our patient was much different than our first. It was, once we got our feet wet, our organization came, so it'd be nice to have, gone back knowing what to expect ahead of time.
Yeah, because had anyone in your group had experience working with, working with patients and, have you had experience doing that? But have you had experience doing it interprofessionally? Working with...
It's a lot different spin on it. I think one thing that would go smoothly if we did it again would help because now I have a better idea of everyone's role. So I know who I know about these kind of different tools in the tool bag that I can help, that I can put to work. And so I think going into this the second time, I know, okay, this is what you have to offer, this is what you have to offer, these are your strengths, maybe these are some of my weaknesses.
Yeah. Well, wonderful. Thank you guys so much. Does anyone have anything they really want to add?
I think that the most rewarding part of this was initially going into it, we had similar goals and values as healthcare providers that we wanted to achieve, and those were illustrated in our team name pledge. So we each recognized initially our different responsibilities, but truly, as we started to work together and come together, those goals really became a reality. We were able to provide all of those aspects to our patient and have successful care. So that was rewarding and a great kind of culminating experience.
Wonderful.
I'd like to say one more thing.
Yeah.
I want to thank the IPEC program for developing a patient case that brought real life and real world problems and challenges to this group of professionals. Oftentimes we, as medical professionals and as healthcare providers, we don't always see the extraneous variables that we need to consider. The fact that Michael was a Vietnam vet, the fact that he suffered with post-traumatic stress, the fact that he was dealing with the use of a now legally okayed substance that we had to address, all of those things are extraneous variables that impact our profession, impact our ability to communicate and provide care to our patient, which aren't things that we're always exposed to in the classroom. So I really appreciated the opportunity to have that exposure and to have that experience to see the patient as a real person instead of as a case subject that we would read about in a textbook. So thank you, IPEC, for that.
Well, IPEC thanks you for your wonderful work and all the effort you put into this project. So thank you so much.
Welcome.
Hello. Hi.
Maybe he'll be able to keep it.
Yes, that was
Even
part
though
of
you
their
guys
plan, throughout the year, whatever.
Do you guys mind telling me a little bit about, so first I want to, so I'm Sarah, I'm going around interviewing.
You're the investigative journalist?
Yes, I'm trying to be. I don't know how successfully I'm doing it, but this looks amazing.
This is Natalie from our trip from Ghana.
I've heard incredible things about this trip, and so I'm excited to talk to you more about it. So,
sorry, I'm going to go look at other posters. This isn't mine.
Are you here alone?
No, there's other students, but yeah, it's fine.
Do you want to tell me your name and what program you're from?
My name's Natalie, and I'm with the Accelerated Nursing Program.
Great. Is this? Are any of your members of your team nearby?
Let me see.
Hi. So if you wouldn't mind telling me your name and what program you're from.
My name's Maggie. I'm from physical therapy. And I'm Hannah, and I'm from physical therapy also.
Great. Well, so if you wouldn't mind just telling me a little bit about the experience and the trip and, what it was like, doing healthcare work internationally.
So I would say that the big difference was like the creativity that we had to have, because you don't have everything that you need and you're kind of looking for something that will kind of serve the purpose of what you need but isn't exactly made for that exact purpose. So that was a lot of it. And then also before we went to Ghana, the nurses had wound care, but we hadn't. The physical therapy students hadn't had wound care, so we didn't learn a lot from nursing about wound care, I would say.
Yep.
Just the trip in general, we took like 30 UNE students to Ghana. We split up into 2 different groups, and we would do a rural clinic and then a clinic in Sekondi. So we rotated each day back and forth and got to see all different types of patients and split nursing, physical therapy, we had vision, we had pharmacy, doctors, public health students. So a combination of all that in each clinic to provide care for, on average like 100 patients a day, somewhere between 60 to 100.
Yeah. What are some of the aspects of this project that you think made it most successful?
Of the Ghana
of your project? And
Probably like collaborations. Collaborating as a team between nursing and PT, because we have different thoughts about wounds. I'm concerned about infection and it's spreading, getting a fever, or comorbidities that the patient has, and PTs.
We think about like how it affects their mobility and their ability to, function and go about their day.
Yep.
So, kind of 2 different sides of the spectrum.
So you all had something unique and different to bring to the table, and something that a different opinion. Yeah, awesome. Would you recommend this trip? For another group?
Oh yeah.
100%.
Well, great. Your poster looks amazing. All right, and finally, just your number one takeaway from this experience. We talked a little bit about like the importance of interprofessional and collaboration and interprofessional work.
I think the same thing, yeah.
Well, that kind of all have more similarities than differences, I think. We all have our own worries about the patient, but in general, we all kind of have the same ultimate goal.
Yeah. Oh, that's great. That's great. Well, thank you so much for talking to me.
Yeah,
excellent job.
Accountable for the responsibilities you take on.
Not on my side.
Sometimes that's an issue with the process, is that you come to an agreement and then somebody drops the ball when you do, and you're all adults.
The issue that we had was one of the girls broke her computer, but she let us know immediately.
That was very much out of her control. She was like, my stuff's going to be in last minute, my computer's broken. Just to let you know it's coming.
Well, at least she let you know.
Exactly.
Right, so you didn't have to hound somebody and say, where's your heart?
Okay. Great. Great. Well, sorry, if you don't mind, I'm the investigative journalist, apparently, that's going around and interviewing groups. So, as you can see, watchers of this live streaming, this group also worked with Michael, our wonderful Michael. Did you give him a last name?
No, he's just Michael.
Just Michael. All right. So if you wouldn't mind just telling me what your name is and what program you're from.
I'm Sam Wood. I'm at the College of Osteopathic Medicine.
Wonderful.
Lindsay Cormier, social work.
Ann Grakowski, occupational therapy.
Great, awesome. And so we can see, here are the names of the other people on the team. All right, so tell me a little bit, we've met Michael with other groups and whatnot, so just tell me a little bit about, what you thought, going into it, what your, worries were, and, kind of like something you expected that just kind of surprised you.
For me, my biggest preconception coming into this was that no one was going to know what OTs do. And I a little bit felt like that, but I felt like much more they didn't assume that I was just helping people get a job. They knew that there was more to the profession than that, and I felt it was really nice for me to explain my role and explain the unique value of my profession to a group of different people who had never really heard it from someone in the profession before. So that was really nice for me.
Yeah, that's great.
For me, it was more of people thinking the generalization of every social worker works for DHS. We just take away kids. And it was really nice that our group is so open and willing to understand what I actually do and can do for a patient.
Yeah, social workers do a lot, and they are everywhere, and people don't know.
On my side, I was curious with so many voices how we would form a collective single voice and translate that to our patient. And our team did a great job of really contributing and listening and creating suggestions and being open to feedback to the point where we could really put a collective whole voice together. And I was really impressed about that.
Oh, that's awesome. Now, what do you think, what aspect or aspects made you the most successful in this project?
Communication.
And organization. During like a wrap-up session, the stimulated patient we worked with said that we seemed really organized. And even though we didn't totally feel that way, with like 6 people in the room and doing like quick transfers and stuff like that, the fact that we came across to him as comforting and organized and professional and as a team, I think was a huge strength for us.
Oh, yes. Definitely. Now, if you were to do this project again, would you do anything different? Would you look at the case differently at the beginning? What were some major takeaways you guys had?
Yeah, I think at the end of the day, I think we all did a great job and we communicated well. There weren't any major things I would go back and do differently. I think experience comes after you need it in many ways, and there are ways where we could organize our clinical experiences a little bit better, the way we organized who was saying what component. And one thing to think about is how many people are in the room at one time. And so to be able to translate to Michael, who said he's a little bit nervous about having health professionals in the room, maybe something we could talk about is having a more intimate clinical experience. But apart from that, I think we did a great job overall.
Great, awesome. That is so spot on. Would you recommend this project, this team immersion, to future classes?
Yes. I think it'll really help you, especially with careers, like that first experience with talking to someone from a different profession. You need as many of the experiences doing that as you can get, and this is the best one. So yes, I would recommend it.
Great, awesome. Well, thank you guys. You did a fantastic job. Synergy.
It's a Y. Didn't really come out with,
Oh yeah. Okay. I'm sorry. Okay, let me rephrase. Synergy.
Yes.
Synergy. Sorry.
It's okay. Thank you.
Thanks so much.
So tell me about your wonderful project.
Email to her.
Hello. Hi. So my name's Sarah. I am going around and interviewing some groups about their projects. Here's the lovely group in their whole. Now, do you mind talking to me for a minute about, first if you could go and say your name and what program you're from?
Hi, I'm Katie Rogers. I'm from pharmacy.
Great, thanks.
I'm Sophia. I'm in osteopathic medicine.
Wonderful.
My name is Richard, and also from osteopathic medicine.
Well, we are happy to have you guys here for the IPEC Day, we can call it. So tell me a little bit about, your project.
So we did a student-run pain clinic in which we had an interdisciplinary team. We included social work and pharmacy, osteopathic medicine, occupational therapy, and I also acted as the physical therapist part of it. And we were kind of guided by Dr. Hull at the Mercy Pain Clinic, and we had one patient that we worked with. He was new to the clinic, so we did the intake, and then we worked as a group kind of discussing what are the concerns that we had based on his history, what other questions that from other specialties that they wanted to know, so that we brought those questions up with him the next visit, and then what were the treatment interventions that we wanted to implement. And then obviously our choices would then have to be presented to the patient, and the patient decided what he wanted. And I think one of the most interesting things was, as an interprofessional experience, is what we thought was beneficial as an interprofessional experience and what the patient thought. And it was nice to see that it very well correlated. There is that we were worried that he would feel overwhelmed with so many people working with him, but he felt that he was being heard. He felt that it would improve his care and that his concerns were being addressed. And he enjoyed teaching the students. You know, given he did volunteer to be a student in this situation, so he was kind of aware of what was going to happen. But moving on, a couple of the things that we foresee as being issues in implementing this in the future is timing. Because even we all had our school and our classes, and coming from different programs, we all have different schedules. So finding the time to meet in the future, when we have a busy schedule and we have busy all the patients, it'll be difficult to kind of meet up with everyone and to get the time to discuss. But I think it is still important, and to be able to understand what each of the professions does and what they can kind of offer in the care.
Definitely. Now, can you tell me, any of you, what the best part of this project was? Someone want to share what your favorite part of doing this work was?
The best part was being able to work with the patient and to learn a lot from Dr. Hall, because I know in my program we don't talk a lot about chronic pain and how to really treat it. We just talk more about drugs to use to treat pain, but not how to really manage chronic pain. So it was interesting to learn from him. And then I think just learning what all the different occupations do. Like, I didn't really know what occupational therapists really focused on, or like social work. They had a lot to say and add to this project side thing.
Great. Does anyone want to add anything?
I'm good.
Would you recommend this project for another class? This experience.
I think I learned a lot from this experience. Mainly is actually being able to understand what every other profession does. I had a little gist, but I never knew kind of to what depth things would be involved. Also, what similarities we had and things concerns that kind of is addressed by other professions as well as our own. And I would recommend it for other years. The only thing I wish is that we had more cases. Having one person in our case, especially because we didn't see that much of a change because there's so much going on and there wasn't that much time to see a change, especially with something that's a chronic issue. I wish either there was more time to follow up or that there were more cases that we would be able to see more diversity.
Great. Awesome. Well, like I said, you guys did a fantastic job. Thank you for being here.
Thank you.
Good. Oh, you took down your poster.
Sorry.
Well, this is their blank poster board. Do you mind though just telling me what your name and program program you're from?
Yeah. Hi, I'm Jocelyn Agura. I'm a senior nursing student.
Wonderful.
Hi, my name is Nihit Mehta. I'm a second-year osteopathic medical student.
Great.
Hi, I'm Madeline Pryor, and I'm a second-year pharmacy student.
And I'll just ask
Carly. She's our PT.
Hi, Carly. No, you can be in it. Hi. So just can you guys tell me a little bit about what do you think made your group successful in this? Because they also did the Michael Team Immersion, so I'm informing the listeners. What made you successful as a group?
Something that I guess was the key to our success was we were always willing to listen. We all are practitioners from different fields, but when we come together, we are always willing to listen and understand each other's opinion and work with each other. And that's I think what's most important: being an active listener and compassionate collaborator.
I agree. We were all really good listeners.
We also ensured that everyone participated pretty much equally as well, so we made sure everyone had input into what was going on with the patient interaction and just in group meetings as well. Which was really great.
Great. Now, can you think of anything that, if you were to recommend any changes, or something that you wish you would have had in this project that it was missing? Can you think of anything?
Time.
More time. It's funny, I've been hearing that quite a bit. Yeah. But would you recommend this team immersion to, the next class?
Yes, definitely.
It was really fun.
This is like an experience that helps you learn from each other's professions. I learned what an OT is. I can never say this enough, but I really did learn what an OT is, which is really awesome because, if I had to prescribe, OT medicine to a patient, I need to know what the OT is going to do, what the scope of practice is for the person. So, and I got to saw that each one of us, regardless of our professions, we are dedicated to being here and helping, our patients.
Great. Awesome. Well, thank you all. And this board once had a poster.
Really good.
It's rolled up. I'll take pictures of it later. Thank you so much. Hello. So my battery might die, but I'm just going to ask you a couple questions about your project. But first, if you could say your name and what program you're from.
Sure, I'm Jessica Harnish. I'm a second year medical student at the Comp.
Great.
Amanda Langley with the Master of Public Health program at UNE. Hi, I'm Allie Newell. I'm a PT student here at UNE.
Wonderful. Well, tell me a little bit about, because I'm from rural Maine. I'm from Presque Isle. So rural health is very important to me. So tell me a little bit about, especially, older populations. Maine is a very old state to begin with. So tell me a little bit about, your experience and some of the things that, kind of surprised you the most or that were the best, whatever you thought was like something worth talking about.
Sure. So I think my biggest surprise was that across the professions we interviewed physicians and PTs, OTs, nurses, and they all had the same issues with regards to access to healthcare and some of the barriers that they come across. So I found that really interesting because I thought it would be different for each profession.
Right. Wow. That is actually very interesting.
For me, some of the most interesting things were just learning about what areas that you don't think of are so rural, like some of the island communities, which are really sought after and seasonal, kind of like as ritzy places in the summer, but they're totally, on the verge of deserted all year round, but there's people that live there, and a lot of them are aging, but the young people don't stay in those areas, so there's no one to take care of them. So that was just a challenge that I hadn't really even thought of in that area, because they become so inundated in the summer, but then the rest of the year there's no one there to help.
Right. I mean, the thought of, having to take a boat whenever you need to get help, and how hard that is. I mean, it's very fascinating. Do you have anything you want to add?
And sort of to jump off what Amanda just said, in addition to there not being a lot of people there in general, sort of year-round, it's also very difficult to access and recruit physicians, PAs, nurses to rural areas in Maine. And so it was interesting to talk to the physicians who were there and have been there for years and how worried they are for the future. They hopefully will retire soon, and there's no one to replace them, so they're really worried about their patients and the continuity of care in their communities. So.
Oh, yeah, wow, that is very powerful. Now, is there, what were some of the, main takeaways from, was this a mini grant? Was it, okay, so it was an IPEC mini grant. All right. Now, since, the mini grant ends, what are next steps? Like, if you had unlimited money, what would you like to continue to do in these areas? What do you think they need, and how could you help them? Or how could we help them?
Yeah, well, one of the main goals of our project was to just kind of gather baseline data on what are the problems, what are some ideas, what are some challenges, and focus in on them to
so that hopefully groups in the future, whether it's through UNE or through IPEC, can kind of jump off of those things and start to work on those problems. And we also have the hopes of like presenting to geriatrics conference so that to get more discussion going on potential solutions.
Yeah, because this is definitely not the end of the conversation for sure. Well, thank you guys so much for, not only just doing this really important work, but for presenting today and, making a very pretty poster. Looks nice. So once again, health practitioner's perspective on caring for older adults in rural Maine. Great. Thank you.
Yeah.
Oh, sorry. Hello.
So that was good. I'm thinking that maybe is like a big difference. For why they have so much less kids.
But that's a great visual comparison, kind of the two.
Ashley made it herself.
Very nice.
Thanks.
So I know we're probably running out of time, but if you wouldn't mind just telling me, your name, your program, and kind of tell me a little bit about your project. So.
Hi, I'm Kayla Fisher, and I'm a third-year physical therapy student. So our poster was about the differences between healthcare in the United States and Ghana. We all went on the 2-week cross-cultural immersion trip. And so through our 2 weeks there, we were able to provide healthcare to about 700 people.
Wow.
And we worked with a lot of local providers, so we were able to really hear from them what healthcare in Ghana is like. As far as physical therapy goes, one big difference is you can see in these pictures over here that in Ghana there's only one PT program for the entire country, whereas in the US we have tons of programs. So the access there is very limited, and a lot of the PTs see a really high volume of patients just because there's so few of them, and PT clinics are usually attached to hospitals, whereas in the US you see them on every street corner, so just the access there is very different.
Wow, that is fascinating. So
I'm Ashley. I'm from the ABSN program. I also went on the trip. And some of the things that we noticed when we were there is just the differences in the diseases and illnesses that we were seeing, benign, like long-term injuries and stuff like that we were seeing, and how different it is comparison from the U.S. to here. So we looked at acute and chronic illnesses, which you can see here, and just the differences in non-communicable diseases like malaria, TB, stuff like that, how prevalent that is there versus what it's like in the U.S. And just kind of trying to figure out what those possible causes could have been, just from the types of food they eat or the carcinogens in the area, stuff like that. And just kind of analyzing that and why we saw what we saw, basically.
Great.
Hi, I'm Felicia. I'm the ABS program as well. One of the biggest things that we noticed was the availability differences. The U.S. definitely has more access to healthcare and facilities, as well as like medical technology, whereas Ghana struggles to get access to those places, especially in the urban areas. So yeah, that's one thing that we noticed the most.
Yeah, wonderful. And do you want to add anything, name and program?
Hi, I'm Alessia. I'm in the ABSN program. I did not go on the mission trip, but I got to collaborate with these wonderful colleagues on, and really based more on the U.S. side. And,
oh wow, yeah, that's a good point, actually.
In comparison, we really they based it off of personal experience, and we're based on what we know in our minds that in healthcare. Technological advancements have been exponentially increased over the last 5 years. And it really brings healthcare full circle and how it's an ever-changing field, and the updates are relevant and important both here and internationally.
Wonderful. Thank you so much. Again, this is United States of America versus Ghana healthcare systems, and excellent visuals. Thank you.